Hi, I'm Dr. Alison Grimaldi, and today we'll be talking hips. When a patient has exhausted non-operative therapies for hip osteoarthritis and reaches the eligibility criteria for total hip arthroplasty, there are still a number of other decisions to make. Hip replacement is not a one-size-fits-all. The patient's gender, joint morphology, and intended use of the prosthesis, what the patient wants to do with that joint, will all be taken into account. One of the key decisions is around what bearing surface will be most appropriate for the patient. The most common options are polyethylene, metal on metal, ceramic on ceramic, and dual mobility prostheses. Polyethylene is a long-wearing thermoplastic. It's the most frequently used bearing surface within the acetabular component. A metal-on-metal prosthesis is often selected when a patient would like to return to high or repetitive impact sporting pursuits, or if the patient is undergoing a hip resurfacing procedure. A ceramic-on-ceramic prosthesis has traditionally been chosen in situations where extreme wear resistance is required, particularly in younger patients. But with advances in polyethylene bearing wear resistance, ceramic-on-ceramic prostheses are becoming less common. A dual mobility prosthesis has two bearing interfaces instead of a traditional single ball and socket interface, and usually includes all three bearing materials. If you head over to my blog on this topic, you'll find a video interview I recorded with Dr. Patrick Weinrauch, orthopaedic surgeon, who walks us through the different bearing surfaces, their types, their advantages and disadvantages. Thanks for joining me, and I'll see you on the next episode of Talking Hips with Dr. Ali.